Hey, hi, and hello, everybody. I'm Meg, and this is M&M in real life. I hope everyone is having a great week. Today, we are actually going to start talking about Ehlers-Danlos Syndrome. Before we get into that, though, I'm going to read a medical disclaimer, word for word, just to make it as clear as possible that I am in no way, shape, or form any kind of doctor or anybody that has to do with medical anything. So all of these videos, all the information I'm sharing they are things that I have found online, as well as things that I have found that personally work for me. They are, try at your own discretion and always run it by your doctor first. So let's do that really quick. Okay, so medical disclaimer. This video is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions you may have regarding a medical condition, and always consult with your physician before starting any exercise program or doing anything contained in these videos. Always stop if you experience any pain, discomfort, or difficulty performing anything that I may have described in those videos. So again, just want to make it clear to everybody that obviously I am not a doctor. I'm just somebody who has these conditions and is just kind of sharing me going through that. So, all right, now that we got that over with, we are going to start talking about Ehlers-Danlos Syndrome. So Ehlers-Danlos Syndrome is a connective tissue disorder where our bodies do not produce enough collagen. And the best way to explain collagen is it's essentially the glue that keeps your body together. So there's collagen in our muscles, ligaments, tendons, organs, skin, even in our bones. So each type of EDS is actually diagnosable with a blood test besides type 3. So those blood tests, they check for certain gene mutations. And I've included additional links in today's video description with some more details as to what would have to be tested for those specific types. And there are some other resources that I'll talk about in a little bit as well. So I mentioned that type 3 cannot be diagnosed with a blood test. So type 3 requires clinical testing to diagnose because they just haven't found a gene mutation that directly relates or causes Ehlers-Danlos syndrome yet. So that clinical questionnaire is also included in the description for this video. And we'll go over that in a little bit, but we are going to start getting into these. So there are actually 13 types of Ehlers-Danlos syndrome. And between today and next week, we're going to stick with covering 1 through 5, which are the more common ones, I guess you could say, even though EDS in itself is technically not all that common. And while I'm going through these, bear with me a little bit because a lot of these symptoms, they overlap. So just some things may seem repetitive, so just bear with me. And let's get started. So type 1 EDS is also known as classical EDS. It's inherited in an autosomal dominant manner, and this means that you can either have it passed down from a parent who already has it, or it may be a new gene mutation. So you may end up being the first in your family to have it. So diagnosis for this type is based on a little malfunction there. So these are based on the gene mutation, so the blood test, as well as assessing some physical things as well. So whether or not you had delayed motor development, low muscle tone, skin fragility, and hypermobile joints. So skin fragility would include stretchy skin, somebody that bruises easily, somebody that bleeds easily, and scars may look very thin and stretched out. And joint hypermobility would include joints slipping out of place, or just pain and discomfort in general, with some inflammation in those joints. So treatment for this type varies from person to person, and unfortunately that's kind of true for all of these types. All of these symptoms affect people differently, so it's hard to diagnose in the first place. That's part of the reason, and it's just it's hard to know what every different person is going to experience. But medications, physical therapy, and braces are very often recommended to help minimize and relieve symptoms. So again, before trying anything like that, definitely talk to your doctor. Even a brace, because like I wore a back brace for a little while before my first back surgery, and they need to be, trying to think of the best way to put this. It has to be guided with a medical professional. That's Zoe, by the way. No, trying to get the camera. So a brace, if you use it, you're removing the muscle's responsibility to keep things where they are and to control things, and instead you're giving the brace all of that control, I guess. So essentially what you're doing is, in not using the proper muscles, is you're going to lose that muscle mass, and that could end up causing more issues. So again, just always talk to your doctor about these things first. So type 2, we're going to move on to type 2. Type 2 is basically a less severe version of type 1. It is the classical type, but it's only passed down from parent to child. So if a child inherits this type from a parent, whether it be type 1 or type 2, then they just, overall, they have less symptoms. And at least to my knowledge, this is just from the research that I've done, treatment and symptoms are essentially the same. But as far as I know, there aren't any known complications or anything like that that has to go along with this type. So that was short and sweet, but that covers type 2. And type 3 is, we're going to get into a little bit. This one has a lot more detail to it, and type 3 is actually what I've been diagnosed with. So yeah, we're going to go ahead and just jump into it. So type 3 EDS is known as hypermobile EDS. And there's almost an endless list of symptoms that go along with it, because there's so many other illnesses that are just umbrellaed under it. Meaning, like, I was diagnosed with postural orthostatic tachycardia syndrome at the same appointment of being diagnosed with Ehlers-Danlos syndrome. So it's expected that if you have one, usually you'll have the other. And there are others, not just POTS or postural orthostatic tachycardia syndrome, but yeah, there are just things similar to that are commonly found in patients who have type 3 EDS. So we are going to stick with how the Center for Rare Diseases defines the symptoms, because there are so many. So we're going to stick with what they give us as what they have found as the symptoms. So this includes joint hypermobility. That includes all joints, big and small. So my fingers end up hurting a lot, and my hands end up hurting, but my hips bother me too. I have to pop my hips multiple times a day. So unfortunately, it affects pretty much all your joints. We are just lucky that way. So as well as the joint hypermobility, that can also lead to dislocations. So I've dislocated a rib, and this shoulder, actually, I'm not going to show anybody, but I can pop this shoulder out of place, which obviously you're not supposed to do. But in general, everything just moves too much. I mean, I sleep weird and something slips out of place. So we also have soft, smooth, and elastic skin. So the skin is going to feel very velvety, and it's gonna be super stretchy. So like I don't even know how much extra this is considered, but like everybody, we just have some extra stretchy skin. That's all. I personally haven't noticed too much of an issue with my skin, luckily, besides the scarring. My scars have kind of spread out and are just thin and look like cigarette paper. So we've got early onset osteoarthritis, osteoporosis, gastrointestinal issues, so nausea, vomiting, bloating, heartburn, diarrhea, constipation. Many of us struggle with all of those issues. Again, because collagen makes up all of our organs as well as everything else in our body. So when that is not fully present to do what it needs to do for us, everything starts to not work the way it's supposed to. So this can also cause a dysfunction of the autonomic nervous system, which would be the POTS that I mentioned, postural orthostatic tachycardia syndrome, or Raynaud's. I have Raynaud's, which is just where your hands and your feet, your extremities, become very cold for almost no reason. It seems like no reason, but it's really just restricted blood flow. That's what it comes down to. Your blood vessels are dilated to the point where the blood flow is not as efficient as it should be. And that's essentially the same idea with POTS as well. It's when you are sitting down and you stand up really quick, your blood isn't able to catch up to get to your head. So you become dizzy and often pass out or faint. So POTS can cause a lot of issues, but we'll cover that in a whole separate video. So to keep going on these symptoms, yes, we still have more. There can be cardiovascular abnormalities, so mitral valve prolapse and aortic root dilation, which is an enlargement of the blood vessel that distributes blood from the heart. Next, we've got increased risk of pelvic prolapse, possibly painful periods and painful intercourse as well. There are no known underlying causes for this type, but it also follows an autosomal dominant pattern. So it could either come from a parent, or you could be the first to have it in your family, like I am. So in order to diagnose type 3, there's a clinical assessment using what's called the Baton score system and questionnaire. So the Baton score is a set of 9 joint movements that if you can do 5 of the 9, you're technically considered to have a positive Baton score, which is then weighed with a physical assessment. So the 9 points are your pinky fingers. So how far back can your pinky fingers go? Your wrists, so can you push your thumb to your wrist? And each of these is a point if you can do them. So that right there is 4 for me. The remaining ones are both of your elbows. So if they're held straight out and in a locked position, do they extend past 10 degrees in the other direction? That's true for your knees as well. So they check all 4 of those, which 3 of mine are positive. So I personally test positive for 8 of the 9 Baton score points. Oh, that last point is whether or not you can put your hands flat on the ground while keeping your knees locked. So those are the 9 points, and as well as those 9 points, to see if you're positive for those, there are other characteristics discussed with your doctor. So the additional criteria for diagnosis of type 3 includes some of the same characteristics that were discussed in type 1, so such as stretchy skin, subluxations, pain. These are all things that go into contributing to a final diagnosis of Ehlers-Danlos. So again, that diagnostic checklist is included in the video description. There's a link for it. So if you or anyone you know may think you have it and you want to just check it out, the link is in the description. So anxiety and panic attacks are very common, which I deal with both, unfortunately. I do take Cymbalta in a very low dose to help with my anxiety, which 95% of the time it does very well. Usually just depends on what else I have going on. So heat intolerance is a big one. I can even take too hot of a shower and actually pass out. I've been carried out of a shower a couple times. So don't take too hot of shower. Do not take too hot of a shower. There we go. Goodness, that's another thing. You know, I forgot to mention the whole brain fog and word issue thing. I struggle hard, often, daily. And unfortunately, that's just kind of how I am. So any of these awkward pauses or anything that you might think was an accident for me leaving in, totally on purpose. Just to give you an idea of what life is really like. Sorry, I have something in my eye. Okay, I think we're good. So, noise and surroundings are also bothersome to me, which I believe they would be for other people with EDS as well. Because we are so hypersensitive to everything, that also corresponds to noise. So noises and smell can just, it can cause too much going on in a situation. For instance, I was at my parents' house for Easter, and we had some family over, but we had the family there, we were playing some music, and I was not feeling great at the time, and it just, I ended up having to ask my parents to turn the music off, because I was ready to completely separate myself from everybody, or completely leave, because there was too much going on. Sometimes there's just too much going on, and I personally can't handle all of those situations. And if you ever are in those situations, do not feel bad if you have to leave. I mean, if it's more comfortable for you, it all comes down to a comfort thing and knowing your body. Do not push your body through what it does not like. Because if we push through those noises and things, that's just going to cause us to use more of our energy, and it's going to cause us to forget other things and just be completely overwhelmed. We could have a panic attack, anxiety attack. It can all spiral. Unfortunately, pretty much all of these can spiral in many, many directions. Oh, I say and so a lot, don't I? Anyways, sorry, that was the cat. Okay, so, yeah, so hypermobility EDS is extremely complicated and can be absolutely debilitating. There are days where I'll take 10 minutes just to crawl out of bed, Or some days I need to sit and rest after I take a shower because I'm just a little too hot. And I mean, just the activity of showering sometimes is just, it's too much. I literally have to get out and sit because I'm tired. There are some days that I prefer just not to get out of bed. You know, I will stay in bed all day when I have to. And I don't feel bad for it. And if you ever have to do that, you shouldn't feel bad for it either. So yeah. So if you or a friend or a loved one thinks they have EDS or does have EDS and would like some additional resources, there are several links in the description for this video. And I would love it if you guys would share your own experiences or comment and ask questions. I'm here for all the questions and comments, everything. I want to talk to you guys. So that's going to be it for today. Thank you guys for watching. And again, please comment any questions or even tools you may use to manage your pain. I'd love to check out new stuff as well. So if you have EDS or an invisible illness, please share your story with me. And I'd also love input from individuals who have other illnesses that I personally do not have. So my first couple of videos discuss what I've been diagnosed with. So anything besides that, like lupus, rheumatoid arthritis, MS, multiple sclerosis, which I'm going to talk to my grandpa about that one. He did already volunteer, so thanks, Grandpa. But there's many others out there, but I would love some personal stories about these instead of just what I find on the internet, because I want everybody to be more aware of all of this stuff, because people do not understand or even have a basic grasp on how debilitating a lot of these can be and what they actually are and what kind of symptoms they cause and what that may actually look like. Thank you guys for tuning in today. I really appreciate it. Again, I'd love some comments and some likes. Also, I would love some subscribes if anybody would like to subscribe. So it was nice seeing you guys, and I'll see you guys next week. Bye.